Pediatric examinations. Roberto dejará la semana. The neurological pediatric examination of infants and children differs from that of older children and adults, principally because of the phenomenon of development. The process of development alters the neurological behaviors and functions that would be expected at different ages. Development also changes the finding on clinical examinations. The goal of a neurological assessment is to detect abnormalities, to localize them, and to monitor their changes. After a complete and successful neurological evaluation, it will be possible to establish a diagnosis and recommend treatment, if indicated, or determine what further diagnostic testing is indicated.
Okay, there it is. Picks up on sound. Assess. Go here. There you go. That's pretty interesting.
Mental status examination. Primary sensory deficit or motor deficit must be recognized, and the effects on the assessment of mental function should be considered. To accurately assess mental state, the patient should be alert and awake. State is one of the components of consciousness. The secondary component, awareness, reflects cognitive function.
Yeah. Church was okay, so I just kind of want to put it here.
Motor examination. In the child of any age, the motor evaluation should begin with observation of the patient's posture and spontaneous movement. Lack of asymmetry of movements can be a manifestation of abnormality. The assessment of functions in a newborn infant or young child occurs within the context of the expected age-appropriate motor abilities.
A child's walking posture is examined as an adult. We know whether the child limps and whether its movements are coordinated. If some pathology is suspected, the child may also be asked to drive.
Walking on the heel and on tiptoe are also
Standing on one leg is not possible for a child until age 5.
Motor exam includes the motor exam includes the muscle tone, the abnormal movement, coordination. Examination of minutes of young infants is limited to observation. Palpation and reflex testing, but it can generally be done without great resistance from the infant if they are not hungry or have other discomfort.
tendon reflex, corresponding to spinal cord segments C5 and C6. The triceps tendon reflex for segments C6 and C7. The radial reflex for segments C5 and C6. The patellar reflex for segments L2 to L4. And the Achilles reflex for segments S1 and S2.
A particularity must be noted in babies. During the reflex test, the baby should look straight ahead because
And finally, the parachute reflex. The parachute reflex is the last of the postural reflexes to develop. It usually occurs at 8 to 9 months of age, when the baby is turned face down toward the mat. The arm will extend as if the baby is trying to catch himself. Prior to development, this reflects the baby will actually bring the arms back to the plane of the body or away from the mat. Thank you.